Okay, folks, now we're going to switch up here a little bit and talk about your skin. That's right, know what to look for when it comes to skin health. And who's going to help us? Gregory Delost. He's here from Optima Dermatology. It's great to see you.
Thanks for having me back on today.
Yeah, so we're getting into the winter months, and we're not out in the sun that much, but the sun has already done its dirty work perhaps on us, and we should be looking for maybe some results of that, huh?
Absolutely. Your skin remembers, and it's not just this past summer, it's a lifetime of summers and accumulation of sun. So skin cancer is the most common type of cancer in the world, and we're always on the lookout for it.
Yeah, so we've heard these different things like you look for unusual spots and that sort of thing. But do these things appear more like certain age people?
So when it comes to skin cancer, I like to break it down to two different categories. We have melanoma, which could be deadly, and not melanoma or non-melanoma skin cancer that includes things like basal cell and squamous cell. So typically things like basal cell and squamous cell involve older people with a cumulative effect of sun exposure, whereas melanoma could be more in all ages.
So when you see a spot like this, like, is it like you go to the doctor immediately? Come see you right now, and you can help figure it out. What does it take to figure it out?
So typically patients come in and we do a total body skin check, and there's some good studies that show that even something as deadly as melanoma, if you could catch it within the first month, it could be life-saving for patients. So we never want patients to wait if they're worried. Our goal is to get them in right away.
So are there, we saw the different shapes and stuff, like melanomas. Are melanomas, like, are they raised on your skin, or?
So melanomas typically are going to be darker. They could be black, they could be raised, they could be flat. And then there's just even a variation of melanoma that is without pigment too, so it makes it even more confusing. So I always tell patients I never expect them to be the dermatologist, but I always emphasize if you see something new changing that you haven't had before, something that's bleeding, healing, but not fully going away, we want to see you right away.
Okay, there's some people out there that have this perfect skin, looks great, and they figure, well, I really don't need a skin check. Do you ever have a person like that and they come to see you and they go like, well, you might have a problem and we should check it out?
Absolutely. Even going back to more the COVID era, where I'd have patients come in for a completely different complaint, and I would have everyone take off their mask, and every now and then we'd find a skin cancer there, and they weren't even there for that reason. So we're always looking.
Are some things that, like on a person's face, are some things difficult to see without like a special tool or light or something like that?
Yeah, so typically we use a special light. It's called a dermatoscope that could help look for patterns, and then if it's suspicious enough, we'll do a skin biopsy, which we'll get it off to our lab, and typically we could figure out within a few days if it's cancerous or not.
Okay, so what kind of move do you have to make then? Do you have to move on to a surgical procedure or a freezing procedure? How does that work?
So depending on what type of skin cancer we're dealing with, there's different treatments. So when it comes to things like basal cell and squamous cell, especially the ones that are on your face or other cosmetically sensitive areas, we recommend a procedure. It's called Mohs surgery, and we just actually brought in a awesome Harvard, Yale-trained Mohs surgeon at our Macedonia office, and the goal with Mohs surgery is while you're sitting there having a cup of coffee, that we make sure all the skin cancer is out that day, so we're able to process the tissue while you're sitting there, and we know that you're 100% cleared and cured of skin cancer, and then after that we could put you back together.
So this is one of those things where you take off a little bit, and then you check the margins, take off a little bit more.
Yeah, I always say Mohs surgery is about 1% action, 99% waiting, so we take a little piece of skin and we process it, and we're able to make a map, and based on that map, if we still see more skin cancer cells on the margin, we could go back and take more. I always use the analogy, I love chocolate, so I always talk about Reese's peanut butter cups. So the way that I could visualize like doing like a Mohs surgery is the chocolate's the skin cancer, the wrapper is the margin we're looking for, so it's really important that we're looking all the way around the skin cancer, but all the way under it as well too. And then if we do it that way, we know we're going to see 100% of the margin there.
Yeah, you make it sound like it's easy, and it is not that difficult. And I think the most important message is it's something that you should discover before it turns into a big problem. Like,
absolutely.
Let the doctor decide whether something should be done rather than you wait too long to say, oh, this might be growing. I'll wait another month.
I tell patients the best thing that could happen is you come in and I tell you it's nothing, and never wasting our time.
Right. Hey, tell us, you got a holiday party coming up, and it sounds like it's an opportunity to learn a whole lot and maybe have some fun too.
Yeah, actually this afternoon we're having a holiday party at our mentor office from noon to 4, and we'll have free cosmetic evaluations, and any of the services and products will be 20% off today.
It says all cosmetic treatments. What does that include? What kind of things is?
Things like Botox, filler, different laser treatments, something called cool sculpting for fat reduction, chemical peels.
There's a lot of
facials.
stuff.
Yeah, all kinds of fun stuff.
Yeah, so if you have questions about any of these things, this would be a great time to go because you can learn about it. If you decide to do something, you get 20% off. That's great.
Absolutely. It's a win-win.
Great to see you.
Thanks
Happy
for your time
holidays to you,
today.
man.
Happy holidays.
Great to see you.